Hi my dear doctors, today we are going to discuss about the TB of the sacroiliac joint. So before going through the TB of the sacroiliac joint, I would like to show you the normal X-ray image of the sacroiliac joint. So you know that the joint is formed between the sacrum and the iliac bone, and it has a mild movement. It can facilitate a mild movement that will help in bending, in moving, in turning your body. So it will provide a minor movement to that of the body. So here we can see that the CT coronal oblique will show a presentation in symmetrical joint space with a regular surface. The joint space is considered as a normal between 2 to 4. So we can see that this joint, the sacroiliac joint here, there's symmetrical on both sides. The joint space are equal. It's approximately 2 to 4 millimeters. There is no widening of the joint. There is no narrowing of the two joints. The joint are quite equal and same with each other. Okay, so it's a normal CT. So in this condition, if we try to look, then we cannot see symmetry on the both side of the body. Okay, the two joints, the both sacroiliac joint, they are different from each other. Not in anatomy, we can see that the space between the two joints is markedly reduced on one side, and on the other side we can say that it is a normal. It's still in the normal, and it will give you more beautiful image, or more clear image if you perform the CT of the sacroiliac joint. So in this condition, we can see that this joint, that is the right sacroiliac joint, is smaller, is narrowed than that of the left sacroiliac joint. So what are the stages, and why there is a narrowing, why not there is a widening of the joint? I will let you know in a while. Okay, so you know that whenever there is inflammation at any part of the body, okay, for example a bacteria or virus or the fungus reach to this tissue, and they start to release endotoxins or maybe exotoxins, and they're engulfed by the macrophages. Then they start to produce different sort of interleukins, different sort of chemicals, different sort of chemical mediators, and that causes a marked vasodilation. One of that is what we can see, histamine. Okay, histamine is very important in increasing the permeability and maintaining the permeability, and increasing, what we can say, the uh, fluid concentration at the particular area. So whenever there will be marked vasodilation, or the vessel become permeable, the more blood start to accumulate in this particular area. Once the permeability is more, then they start to leak out into the interstitium. So once more blood will flow toward the particular area, there will be more cell, that is inflammatory cells, neutrophils, or some sort of antibodies. They start to reach at this particular area, okay, and fight against the microorganism. So we can say that will be exudation. It may be fibrous exudation, it may be some sort of what we can see, hemorrhagic exudation, or it may be only exudate, transudate, in depending upon the virulence of the organism, either it is virus or bacteria, or some sort of fungus. Depending upon that, there will be different exudate. So the same thing will happen in the joint as well. Once, for example, this is your joint, it's a normal joint, and there is an entry of the microorganism or some sort of other foreign particle will be present here, then there will be a start to increase the secretions, start the endothelial, or we can see the lining of the synovial membrane. They start to filter more blood, and because of the vasodilation of the microvasculature, there will be entry of more inflammatory cells. There will be exudation. In simple word, we can say that exudate can also found in acute stages of the arthritis or the inflammation of the joint. So here there is exudation. Once there will be marked exudation to fight against the organism, there will be widening of the joint. The joint now become widened. The bone are pushed away from each other, and there is a widening of the joint. So we can say that there is a widening of the joint, and physical examination, the joint will be swollen, and there will be hyperemia, there will be we can say pain as well. So those are the physical findings over the joint. But there will be a widening of the joint. So this happen in early stages or the acute stages. If this process is not treated well, and if we kept this like that, and keep the process of the inflammation keep going on, then what happen, then the exudate is no more simple exudate. There will be some sort of fibrous exudate. There will be the chronic inflammation. If the bacteria or the virus is more highly virulent, then what happen, there is not only a simple exudate, there will be a fibrous exudation. Fibrous proteins start to accumulate into the joint. The joint fluid now become reduced, and the bacteria become over, the toxins become more, and the inflammatory chemicals will become more. So all of these particles, all of the chemicals, all of the components, they start to destroy that of the cartilage over the joint. So in chronic stage, what happened, there is erosion of the joint, the joint space, erosion of the joint cartilage. There is a destruction of the joint cartilage. Now the joint is no more widened. Now they come close each other. They become, the space become narrowed, the surface become irregular, and there is a fibrous accumulation between the two joints. So that restrict your movement, that causes the fusion of the two joints, and there will be fibrous ankylosis, or we can say that in case of one of the disease, that is ankylosing spondylitis, is a fusion of the vertebral column. I mean, there is a formation of the fusion of the two vertebra with each other, that limits your movement, that causes pain, that causes other complications as well. So the same thing happen whenever there will be inflammation of the joint. Okay, so in this condition, the joint space, that's why we can see that in this condition the joints space become reduced. So why not increase, why not the widen? So we can see that because it is no more in acute stage, it is present in the late stage or chronic stage, that leads to narrowing of the two joint. If it is early stage, we can see there is a widening of the two joint, and on physical examination there will be pain, there will be swollen, and there will be a reduction in the movement of the two the two or at the joint. Okay, so what are the radiological features that will help you in identifying on X-ray image that it is arthritis, or it is late arthritis, or chronic arthritis, whatever that? Okay, so it is the feature, for example, the features, they are the plain film are reliable to detect and follow up a treatment for tubercular arthropathy. A triad of radiological abnormalities like fenestrous triad. This fenestrous triad is very important, that will help you in identifying that there is the inflammation at the joint, there is arthritis or not, there is what you can say synovitis or not. So we can say according to that. So the features, they are the pre-articular osteoporosis because of the inflammatory cytokines, that will be peripherally located is osseous erosion, there will be a gradual diminution of the joint space. So all these features will help you that yes, here start inflammatory process, and here start arthritis. So the stage, now we will talk about the stages. So as I said, that there are two stages that will can happen in case of the arthritis. Number first is the early stage, and number second is late stage. The early stage is also called as the stage of synovitis and stage of arthritis, because there is inflammation of the synovial membrane. Because of that, the synovial become thick. There will be what we can see widening of the joint, and there will be inflammation of the joint. So because of that, there will be we can see that there will be arthritis. So what are the radiological features that include that so in that condition, in case of early stage of synovitis and arthritis, we can see pre-articular demineralization, the joint space widening because of the effusion or the exudates at the joint space, and some sort of mild subchondral erosion. As I said, that mild or subchondral erosion we can see in case of late stages, but there will be some sort of mild subchondral erosion can also seen in case of the acute stage or early stages. Okay, so what are the features of the late stage? The late stage is also called as the erosion and a destructive phase or the destruction phase, because there is a bone erosion and there is a destruction of the two joints. So destruction of the two bones that is forming the joint, and there is a gradual narrowing of the joint. There is an involvement of the articular cartilage come closer to each other. There will be erosion between the two joints, and they start to rub against each other, and because of the rubbing of the two joints, sometime in case of the osteoarthritis, we can do osteophytes that are formed because of the two joint erosion, because of the fusion of the two joints and the rubbing against each other. The joint stability loose, and there will be subluxation, whatever that we will tell later. So there will be severe subchondral erosion and destruction. There will be pathological subluxation and dislocation of the joint, because once the joint come closer to each other, the cartilage that was providing enough friction become between the two joint, they were providing a stable movement. So once there will be erosion of the joint space or the joint cartilage, there will be the loss of stability. Once the two bones forming the joint, they become erode, and there is no cartilaginous surface over the joint, over the two bone, then the joint become unstable. So on applying a little force, there will be a mild subluxation or dislocation at the joint. Okay, so and fibrous ankylosis can also see in case of hip joint. We can see fibrous ankylosis sometime in case of tuberculosis, and septic arthritis can give, but not so common. Okay, so the joints become closer to each other, they rub against each other. There is the infiltration of the fibrins, there is a deposition of the fibrins between the two joints that causes the fusion of the two joint with each other. In that condition, what we call this fibrous ankylosis, that will markedly reduce the movement of the joint. So in contrast to epiogenic arthritis, the development of bone ankylosis is uncommon in TB arthritis. When see, there is likely to be secondary to the prior intervention. So we can see that in case of some prior surgeries, and then in that conditions, if the joint is affected, in that condition we can see that fibrous ankylosis. So what is atrophic changes? So atrophic changes in joint may occur and leads to atrophic arthropathy. That is seen in case of shoulder joint is caries sicca. So caries sicca is nothing, it's a TB of the shoulder joint. Okay, so I hope you understand that what I want to say about this image. So it is a TB of the sacroiliac joint on the right side. So this joint is affected. So if you want to give a conclusion, then you need to if you want to talk about the sign and symptoms. So there may be a unilateral pain. In this condition, the pain is on the right side. So we can see that the patient will complain of some sort of unilateral on the right side back pain that will aggravate it at night time, that will limit the movement, that will aggravate it when the patient try to pick up some sort of heavy object, when the patient try to move, try to stand, try to bend, okay, try to stop himself or herself, then the pain will increases, and there will be night sweating, and there will be some sort of other complications in if it is TB of the joint. So why we can see this is the unilateral. So what will you guess? So we can say that maybe it is not a hematogenous spread of the TB, and maybe unilateral, so it may be some sort of direct invasion, and that is very rare, and or it may be some sort of lymphogenous spread of the mycobacterium tuberculosis to that of the particular joint on this side. So on the black things that you can see here and near the joint, so these may be the soft tissue involvement of the inflammatory process. Okay, so if you want to give a conclusion for this, so you don't know that either it is primary or secondary, either it is come from lungs of the patient if the person is already has some sort of TB of the pulmonary system, and now the patient has joint problem, and then you can see that it may be secondary from the what we can see from the lung, or it may be some sort that the microorganism enter directly into your blood circulation, and from the blood circulation it is to here. So it depends. So it may be on the your conclusion should be like this. It may be primary or secondary TB of sacroiliac joint, right side, and what is the phase? Either it is acute or chronic, or in early or late. So it is a late phase. So it is pulmonary, so it is primary or secondary TB sacroiliac joint, right side, late phase. So it should be your conclusion. Thank you very much.